Hello and welcome to this VOA webinar on how to get started on your research project and create a scientific poster. My name's Meg Brady and I'm the VOA Scientific and Education Board member, and I'm also a Senior Account Manager for Uppsala. I'm joined today by Professor Clare Rusbridge.
And I'm a veterinary neurologist and I work at the University of Surrey and also in clinical referral practice at the VOA Referrals, which is in the Northeast.
Fantastic. Well, I know that even starting research can be really daunting. And what we wanted to do with this webinar was break things down for our VOA members to make things more accessible. So the webinar is intended for vets, nurses, paraprofessionals who are maybe not in academia, they're in everyday practice. So we want to encourage more people to get involved, share their ideas, their cases, and straight out of research for their everyday patients. So, Claire, where do we get started with this?
Well, what we're talking about here is clinical research, which I'm really passionate about because this is non-laboratory animal research. And I think that's incredibly relevant because we all deal with real animals, real situations, animals with comorbidities, other problems, difficult environments. And so our observations have huge pertinence to the real world that we live in. So clinical research is that research that elucidates biology of disease, its control, and its treatment. So you may be doing a study which we would call a systematic investigation, which is where you either give an intervention, for example, you give a drug or a supplement, or is observational. So, for example, you may be looking at the prevalence of cats that have osteoarthritis in your practice over a certain age. You could be doing an epidemiological study. So you may be looking at the kind of patterns of disease, the causes, the effects on health and disease in animal populations. So, for example, you may want to look at whether osteoarthritis is more common in obese animals. I guess we might think that that might be the case, but you might want to look at the opposite effect. What happens when animals lose weight or the other comorbidities that are associated with osteoarthritis. This would all be epidemiology. And then the final type of clinical research is what we call translational research. So that is where something has been discovered in the laboratory and then is applied in a clinical setting. So I suppose the classical example of that is if a drug has been tested in a laboratory setting or a laboratory animal, and we want to find out whether or not that drug has true efficacy in an animal with arthritis, for example. So one of the questions that we have is, why do clinical research? Why bother? Well, actually, many colleagues that I speak to, vets, vet nurses, vet students, physiotherapists, and other paraprofessionals are all often interested in clinical research because they have a natural curiosity. They want to know why, what makes their animals better, and obviously they care about the animals that they treat and would like to have better answers. However, there is other reasons why you might want to get into that. First of all, it has been shown that it increases job satisfaction, that you have that sense of personal accomplishment, that feeling at the end of the day, oh, I did a good job, not just doing my regular job, but having achieved something else. And there's also a study that that showed that there was reduced risk of professional burnout. I think because you have another sense of purpose and something else that you want to achieve. Obviously, it's good for career development if you want to show that you are other skills that you might have, or other things that you can show to your employer that make you of value. For example, that's something that you have developed during a nurse's clinic, for example. And you may also be able to show, well, I developed this in my nurse's clinic. And now this has been translated into this output of increased sales of X, Y, or Z, or increased turnover, people coming back to the practice. The other important thing is it allows you to basically do an audit. You may be able to say, well, actually, when we put this poster up in our waiting room, I was able to get this many clients asking the question to the vet, well, actually, I think my dog is in pain, and therefore, can you evaluate it for having osteoarthritis? And that this animal was then put on appropriate treatment. So you were able to see, actually, by doing this intervention, we were able to generate more business or help animals in this way, and of course, develop new strategies. But there are some barriers to clinical research. There's no doubt that this is something that you need to go into with enthusiasm, but I would say the biggest barrier to clinical research is time. We all have great ideas and think this would be fantastic if we could do this, but do we have the actual time to do it? So one of the biggest things you have to do before launching yourself is, do you have the time to do it? And linked into that is, do you have the resources to do it? It's a great idea, but can you actually achieve it with what you have? Resources meaning money, but also other uh, resources, such as if you need a colleague to help you, if you need to have clinic time, that sort of thing, administrative staff, sending out leaflets or questionnaires or something like that. So all of those are resources. Do you need support doing it? It's I hope that most people are in practices where they have an environment which fosters collaboration. But I think, some of us are in environments where people are disinterested. And you may need to speak to somebody to help get you that kind of support within your practice to be able to set up a project and keep it going. And sometimes it can be very useful to acquire a mentor to help you set up the project. It can seem very daunting. And I can tell you that at least in our universities, and I'm sure in most universities, all universities that do the vet school, veterinary nurses, that sort of thing, you'll find there are people in that environment that are happy to mentor you. Basically look over a project and say, yeah, that's a good idea. No, that's not going to work, that sort of thing.
So have we got any
Um,
ideas, maybe little bits of inspiration that we could give to our vets, nurses, physios that maybe haven't done this kind of research before? Are there topics that they could see in their everyday work that we might be able to kind of spark a bit of interest with?
Well, all research starts with a question. So yes, and I think we all have questions, but these can be quite simple things. So weight, I've mentioned already, has to be the most important disease comorbidity that many animals are dealing with. And so I've divided the kind of question that we have here into these sort of five different categories. So etiology, so question to identify and understand the cause of a condition or disease. So going back to that weight there, what animals are overweight in the practice, and is this more likely to be associated with a problem? The animals that are overweight, um, are they more likely to be certain breed? I think we can all answer that one very quickly. Yes, there are definitely some breeds, hands up those that are Labradors, that are more likely to gain weight. But maybe that's a very simple question. We already know the answer, but maybe there is other um, uh, uh, factors that could be looked in. For example, on cats, are cats that are completely indoor only more likely to be overweight? Are cats that are in multi-cat households that more likely to be slimline because they're more likely to be playing with the other cats? Or perhaps not, because they don't like the other cats. So looking at questions to identify and understand the cause of a condition or a disease. And then we have prevention, questions relating to disease development. I suppose one thing that isn't quite osteoarthritis, but something that a lot of you might be dealing with would be intervertebral disc disease. Now, in Dachshunds, let's just pick on a breed. Many Dachshund owners will come to you and say, how do I stop intervertebral disc disease developing? Now, you can say the obvious one. You could say avoid weight gain, getting back to that weight question. Well, that's fairly obvious, but what about activity? Should we stop Dachshunds jumping? How do you stop a Dachshund jumping? Should we prevent Dachshunds doing stairs? Should we only take them for a certain amount of walk? Actually, those questions have already been asked, and actually the answer to that may surprise you, that doing stairs does not increase risk of Dachshunds getting disc disease. Jumping does not increase risk of Dachshunds getting disc disease. Who knew, without somebody asking that question and doing a big questionnaire and asking? And actually, there's more evidence that keeping fit and trim is probably more preventative. So the Dachshunds that are more active are less likely to get that intervertebral disc disease. But that's not the advice that many people are getting given. So that's what I sort of would say, well, maybe there is another question that you might have. Are dogs that are restricted during the first few months of their lives? Some people say you shouldn't walk a dog off their leash during the first 6 months because that will make hip dysplasia more likely. Does it? I don't think anybody's actually looked into that. So the amount of exercise that a dog, the kennel clubs and other organizations state it, but has anybody actually looked at that? And so looking at risk factors, early environment, for developing hip dysplasia or elbow dysplasia. Early screening techniques and standards. Are animals which were got from screened parents less likely to get disease? Then we have diagnostic tests. Can we perhaps you're working with a company and you're able to look at a diagnostic test and say, well, this is useful or this is not useful. But perhaps you can just ask that question yourself. One thing that I thought was quite a good study is I get very frustrated as a neurologist that everybody thinks that every cat that walks through the door needs to have a test for toxoplasma. I can actually count on the fingers of both hands in 30-year career how many cases of toxoplasma in a cat I've actually seen, and it's less than 10. It is a pretty rare disease for me to see. Yet every cat has to have a test for toxoplasma, and that costs over £100. So is it really worth me spending a client's valuable money doing a test for toxoplasma? Or perhaps I should only do a test for toxoplasma if, for example, there is another test that is abnormal, for example, of raised muscle enzymes and liver enzymes. So you could look back at your diagnostic tests. Let's pull an osteoarthritis example out. Let's say polyarthritis, immune-mediated polyarthritis. Is it really beneficial to do a whole body or abdominal and thoracic CT? Now, out there in the real world, we know that's not going to happen. But in my sort of referral practice, often we're told, well, you should do that because there will be cases that will have cancer and that sort of thing. But in a young dog, how often, or any dog, how often is that test abnormal? That is, as far as I know, that is not a test. That is not a question that has been asked. Then we have therapy. So questions relating to selecting appropriate treatments, risk, benefits, efforts, and costs. Well, I can think of a good one here, and that's a controversial subject. How about our monoclonal antibody therapy? We need more information about that, don't we? Our Librela and our Silencia. There's a treatment that for many animals resulted in a massive increase in quality of life. But controversially, we now have a issue where some animals might or might not, it hasn't actually been proven as far as I can see, have an increased risk of what they're calling rapidly progressive osteoarthritis, but they haven't actually proven rapidly progressive osteoarthritis in dogs yet. It should be said that that is a condition seen in humans. So, wouldn't it be great if there was a study that actually, and presumably they are out there, but I would love to read a study that is saying, okay, what is the risk benefit with giving um, a certain dog Librela? And that risk benefit is probably going to be different if it's a 10-year-old dog with multi-limb osteoarthritis compared to a younger dog with just developing osteoarthritis because of elbow surgery for a breed related or conformational problem. So what is the risk benefit? How many animals are actually having a problem with that? And then we have prognosis. When people come to you and they say, I want to have a treatment for my dog, but I want to know what's the prognosis? Is it worth doing? And so these are very important questions to be asking. What is the survival rate? I can give you one example of a study that I did, one of the first studies that I did. I compared two different surgeries for caudal cervical spondylomyelopathy. Some of you are probably going, what's that? That is Wobbler's syndrome in the dog, not the horse. So Wobbler's syndrome in Dobermans, two different types of surgery. And the most interesting thing that I found was that when Dobermans had surgery for that, within 2 years, 25% of them would die of cancer or cardiomyopathy, which was quite stunning to me. So I have to now say to owners following that study that actually, when you present your 7-year-old Doberman for this complicated spinal surgery, there is a reasonable chance that they may get something else serious within the next 2 years. Maybe you'll say, oh, that's obvious. It's a 7-year-old dog. Well, actually, no, it's not. Many owners think their dog is going to live to their 14. And so knowing that their dog could have something else serious is an important consideration whether to consider going forward to having a big spinal surgery.
So we've
So
got a few ideas there, really, haven't we?
yeah,
So in practice, we could be looking at doing an owner survey, for example, which could identify historical ways that dog was raised, where they bought it from. It could be how much activity that they have, even looking at sleep, like with the snore score, for example. So we're looking at owner reported surveys, or we could be looking at our own clinical data for pulling off that from our practice management system, or perhaps we're looking at something a little bit wider than that to get a little bit more of an outline of disease progression for things like the etiology or the prognosis.
yeah,
Would you say?
exactly. And I think the important thing is that a good question really needs to be specific and focused on a single topic. So many people are, they come in and they're absolutely wonderfully enthusiastic and they say, I want to know more about, do more about this disease, find out more. And they'll sort of say, well, I'm just going to go through all of our records. We just want to go through all the records on X disease, should we say elbow disease in Springer Spaniels, and find everything there is to know about it. But what you really want to look for is a specific question on that topic. So elbow disease in Springer Spaniels before 5 years old, whether or not they were fed an appropriate diet, or perhaps had a diet with potential deficiencies in, or were overweight or neutered early, to that, which would be a good one, the neutering early or not. So you have a specific question. Is osteoarthritis secondary to elbow disease more likely in dogs which are early neutered compared to later neutered? So you're able to focus in on one single question rather than the entire topic. And you also need to have a question that's not too simple, that is not just yes, no. You're able to look at it in depth. You need to be able to put the existing literature and the subject into context. So going back to that neutering one, then we would need to be able to say, yes, well, we know that early neutering may be associated with increased risk of osteoarthritis, especially in larger dogs. And you need to be able to make it realistic in time and your scope and your budget. And now I put there at the size, it needs to be feasible, interesting, novel, ethical, and relevant. That sort of finer acronym.
So, for example, if we were looking at neutering and its possible link to osteoarthritis, you could survey the owners within your own practice. So those dogs that have osteoarthritis, maybe some, another control group that don't have osteoarthritis, and then asking those simple demographic and historical questions of what time they were neutered and
Exactly.
where they were purchased from, and that kind of thing, that would give you that that information just within your cohort of your own practice.
Yeah, and that would be interesting, because a lot of the data on these sorts of things are coming from referral practices, and not general practices. And actually, that all as soon as it's a referral practice, then it becomes a bias, because of the demographic of the person that attends that practice.
Yeah,
You do need to
absolutely.
make sure things haven't been done already. So the I'm not so familiar with all of the literature in the osteoarthritis world, and so although I've been sort of saying some studies, these might have been done already. So you need to, when I say puts the existing literature into the subject into context, you also need to do a literature search and make sure that it's not been done already. Other things that you may need to avoid. Um, you need to remain focused, and can be quite difficult because one question often begets more. And I find this with early researchers, they get so involved with the subject, they just want to solve everything regarding it. But it is better to say, this is my question, this is what I'm investigating, and then if I've got more questions afterwards, that's next year. And when you look at people who've been very successful with their research path, they've often remained incredibly faithful to their main research topic. I don't know if you can class me as successful or just boring, but I research Chiari malformation and syringomyelia, and I have done so for over 25 years now, because I still haven't cracked it. I still haven't found the right answer. So, or any enough answers. And so one question always results in another question. The other thing to avoid is reporting large retrospective clinical reviews. That is what most people try to do. They think, right, I'm really interested in this disease. Let's look at every single case we've had of this in the practice, and write it all up. And the problem with that is that the workup of each individual case is very varied, and it becomes very, very messy. So it's much better to think, rather than trying to put everything in, to focus on that specific question. Are they early neutered? Did they lose weight? Did the owners exercise them off the leash? That sort of thing. You then need to look at how you develop your question. So you have your question, early neutering. Shall we stick with that one? Then you need to start looking at all the literature on early neutering. I use PubMed. Some people use Google Scholar. There's all sorts of forums that you can have. You could even, I suppose, use AI, but be very careful because it lies. So if it can't give you an answer, it makes it up. So I would be extremely careful in asking a large language model to get my research for me. But there are now veterinary specific ones of those which will tell you where they're getting their data from. Narrow your focus to a specific niche. So I've put in some neurology examples there, but you could say elbow disease and early neutering, or hip dysplasia and letting them off the lead early. Focus on a specific outcome. So this can be, for example, animals that are eventually having needing pain relief. I would say that's a bad outcome because that depends on the owner bringing the dog to you to the vet for that medication. You could look at doing a much more specific outcome. For example, you could introduce a load questionnaire into your practice. Or something simpler. You could look at for example, if you run a geriatric clinic, you could look at the BSAVA Pet Savers aging canine tool. If you've not looked at that, check that out. It has a number of sort of traffic light questions which the owner ticks, and you could look at, and some of those are related to the dog's mobility. So you could just have the owners of your geriatric clinic do that. Keep all those results and then look at the mobility question. So your question has to be answered within quantitative and qualitative data. So what does that mean? So qualitative data means the stuff that you can describe. So you can say that we had X many dogs participate in our study. That ranged in weight from 5 kilograms to 50 kilograms, and you were able to give numbers to some of those. So we had 50% of the dogs that I saw had elbow dysplasia, that sort of thing. And finally, you mustn't be able to answer it by a Google search or a ChatGPT search, I suppose. So going back to the early neutering, you would have if you put that in, is early neutering associated with an increased risk of osteoarthritis? Well, it would come up with some data on that because they have already been studied. So you need to be refining that question somehow. Your next thing you need to do is your question feasible? Do you have time for it? And this is really important because I've seen so many people think, I'm going to do this project, it's going to be wonderful. And then they just don't have time for it because they are busy people doing a job. And if you are relying on your colleagues collecting data or samples, then you need to make it really, really quick and easy for them. And sorry, all the vets that are out there, ideally not the vets because they are the worst at getting your data. Sorry, vets, but nurses and physios are better. And I would use as an example there for the vets is how many times have you filled out a yellow card, so-called yellow card, a drug reaction card, when the dog has a minor drug reaction? How many people actually fill out that card when an owner who's been given a dog non-steroidal anti-inflammatory drugs develop diarrhea? Really, be honest. You might do it if the animal died, but even for a minor vaccine reaction, did you do it? And this is because it takes time, even though they make it as easy as possible. And these drug reactions are massively underreported. So I use that as an example because that is asking a busy vet to go and do something and remember to do it after they've done all of their consults, after they've filled up those drug requirements. So if you are asking people to do something in addition to a regular consult, you really have to have lots of strategies in there to make sure that it gets done. So it needs really to be part of your regular provisions. I've just this here, that this little biomarker for OA study, this is completely and utterly made up. This is, I don't think this QR code goes to anything. If it does, it's probably just my YouTube channel or something like that. This is a made up study. So we're looking for a biomarker for here. We've got dogs that are coming in and prior to getting some sort of treatment, they're having a hematology. So we have an EDTA blood sample that has been taken. And this is all people have to do is label the sample with the dog's name. This is leftover blood, by the way. That's very important from an ethics point of view. We've got a prepaid envelope in our practice lab. We have to scan the QR code to enter the dog's details and put the envelope in the post. Not very difficult. You would be surprised how nothing gets taken. So I would say that this is very unlikely to be done by a busy vet. And if I wanted this done, I would ask my nurse in the lab team to help me do that. And to remind everybody, I would make a big poster and constantly remind people about it, because otherwise, if you're asking people to ask every dog that's on, meloxicam for osteoarthritis to do something, it just might not get done, and then you have a massive bias in your sample. So one of the big questions that often comes up leading on from this biomarker thing is, does the study actually need a ethics review? And I've put actually here is, don't be scared about the ethics review. I've been recently talking actually to some people about setting up a study. And this is part of the charity that I'm a trustee for, the Dog Breeding Reform Group. They'd love to do this lovely little study. I think it's a great little study, but they're saying, no, we don't want to do it if it has to have an ethics review. And the vets on the panel are saying, this needs an ethics review. You can't do it without an ethics review. And so, no, we've not got enough time for that. Well, I would actually say do the ethics application because it helps you to plan your project and makes you think about potential issues in advance. So this is the Royal College of Veterinary Surgeons ethics review. And I've just put this down in the background. You go onto their website and the form has three sections. It has your details. It gives you your study design details. And then it gives you your practicalities, so things like consent forms, funding, and data storage. Data storage is not just where you're going to keep all of your samples and answers. Is if you want to do something like a questionnaire to clients, you do have to think about how that data from that client are stored, especially if you're keeping people's names, because of obviously for the client confidentiality and GDPR aspects, and anything where you're keeping people's names and asking questions like that should have an ethics application. So I thought it would be helpful because people are very scared about this, or actually, I want to say not so much scared, but apprehensive, to go through a few basic details of what you might be asked to fill in. And I apologize that this slide does look a little bit intimidating, shall we say. So, but this is the questions that are asked. So first of all, the purpose of the study and the site study that will be performed. So that should be fairly obvious. A basic outline of the study what you are going to do. So, for example, maybe you are looking at early neutering effects on elbow dysplasia in your practice. So basically a little bit of an outline about what elbow dysplasia is. Remember, the people reviewing it may not have that knowledge that you have, and how you're going to investigate it. Your inclusion and your exclusion criteria, I'm going to come to that later. Sample size and justification. People often say, oh yeah, I'll do 30 dogs. Well, how do you know that 30 dogs is going to get you the answer that you need? Is it routine veterinary practice? Now, I'm going to think with our demographic, it is likely to be routine veterinary practice, and actually, we're not going to go into anything outside that in this particular webinar, because that's really the subject of another type of webinar. When I last looked at the form, it actually said recognised practice. They needed to update their form. Maybe they've done that all now, but routine veterinary practice basically means something that you do as part of veterinary practice. So you would weigh a dog as part of veterinary practice. You would do a nurse's clinic, a geriatrics nurse's clinic as part of veterinary practice. You would prescribe a non-steroidal anti-inflammatory drug for a dog with osteoarthritis related pain. That's routine veterinary practice. Some things that are not routine veterinary practice would be, for example, deciding to do a novel surgery for osteoarthritis that had no basis in scientific literature already. Actually, you may say, oh, surely that would be very innovative to do a new surgery that was completely and utterly novel. Well, actually, now the Royal College of Veterinary Surgeons would actually regard that if there was a standard surgery as not routine veterinary practice and should be looked at by an ethics committee before. So does the study need an animal test certificate? This is really out with clinical practice, because that is that wouldn't apply unless it was translational research. You need to look at the benefits to the animals. And then you need to look at the ethics of consent to the owners, what you're doing with the information, confidentiality, and minimizing the risk to the animal. How you will assess success. That's quite important, because, for example, if you're giving, let's say, a nutraceutical for which doesn't require a license, a nutraceutical for an animal with osteoarthritis. Well, how are you going to say the animal is better, given that there's a placebo effect, and many owners want to say that the animal is a bit better, or they so how do you actually decide that it genuinely is better? Maybe it's how far the animal is walking. Maybe it's a validated questionnaire, which I would argue is by far the better technique. So something like the load questionnaire or similar. How will you assess failure and how failure impacts the animal? So that for that sort of thing would be a more typical kind of research where you've been given a drug, and the drug is not effective. What are you going to do about it then? How are you going to rescue that animal? So with the inclusion and the exclusion criteria, beware of sampling bias. So if you have a questionnaire that you send out on your practice social media, bear in mind that people most likely to fill out the questionnaire are your motivated owners, and therefore they may have that kind of bias. So your best sampling is consecutive from an accessible population. So, for example, going back to the early neutering, perhaps you will look at all of the dogs that were neutered at a certain age in your practice. You must be able to justify that, and you need to be specific. So, for example, I'm looking at a disease here, MUO. We can replace that with any disease, osteoarthritis. So a bad example is all dogs with this disease. So all dogs with osteoarthritis. Because first of all, we need to know how is it determined that the dogs have osteoarthritis. Clinical examination only, that is going to be most of the dogs. or ones which have had a radiograph. That's going to be a biased population for people who can afford a radiograph or are insured. And maybe a better example is all dogs that have been diagnosed by a neurologist. Well, again, that's going to be a biased sample because that's referral practice. But for that particular disease, that's probably going to be more accurate. Exclusion criteria. Please do not just list the opposite to the inclusion criteria, all dogs without MUO. So better would be all dogs diagnosed with MUO, but without the MRI being typical. The next thing you need to do, so you've decided how you're going to include and exclude your dogs. The next thing you need to do is actually a power calculation. This is going to terrify many of you, but please don't be terrified. There are now online versions of this, and secret, you can do it on ChatGPT as well, or other things. They will often do it. I don't know how accurate it is there, but I do know that people have done it that way. So this is an example of the one that I use, which is completely free. So what I need to do is to choose my study design group. And I'd say, why do you need to do this? Well, I'm giving an example of epilepsy here, and I'm sorry for the neurology examples, but this one is a good one, is that a positive effect of a drug is actually defined as a 50% reduction in seizures, which I always think is a bit, well, rubbish for the animal, because if you're having 4 seizures a week, then a positive effect is actually having 2 seizures a week. And I think most clients would still think 2 seizures a week was a lot. However, there's also a placebo effect. You wouldn't believe it in epilepsy, but there is. And there is definitely a placebo effect in pain. The placebo effect in pain is about the same one as in epilepsy, as high as 25%. Why would that be? Because the animal is presented to you, the veterinary practice, when they're at a peak of their disease, just had a seizure or in a lot of pain because they went for a big walk. And then because of the natural history of the disease, they go away and they don't necessarily have, during your follow-up period, as bad a period because they're not being excessively walked or they're just not having seizures. So the placebo effect can be as high as 25%. So it means that we need to know how many animals we need to include in our study so that we can see a difference which is as high as this, but not as high as that. So we choose our study. So I've got 2 independent study groups, as opposed to 1 study group versus your population, your whole population. And we have our endpoint. So is it going to be a simple yes, no answer? Or is it going to be an average answer? For example, the blood pressure reduction or the weight loss. So then I need to put in my error rate. So here is my error rate. So I know that I want group 1 to have at least 50%, and I want group 2 to have 25, because that's what my placebo effect is. So this so it does mean that you need to have a little bit of an idea of what you expect to see. But if you don't, then you may want to just put in a few random answers just to see what range of samples that you get. And this tells me that for doing a study for looking at an epileptic drug, I need to have at least 116 animals. With 58 animals in each group, and I would need more than that, which I think is quite an interesting answer, given that many studies on epilepsy drugs have considerably fewer, which says an awful lot about epilepsy drugs. So many studies are underpowered as a result. And then we need to put in our type 1 and type 2 error rate. So this is basically your ability to detect a difference between the groups where there is actually a difference. And it helps you there because it says most medical literature uses a value of 80 to 90%. So we just set it to 80. and most of the type 1, the alpha power rate is in this range here, and so we want to have put it just in the middle there, so we're going to make it 0.05, and that can be the simple way of doing those things. And it's much easier to do this in advance than to go all the way to paper publication, and people say this is an underpowered publication and can't be published. So it avoid people think, oh no, I don't want to do with that. It's too difficult. It's too much faff. Well, it's an awful lot more faff if you've written an entire paper and then people say, no, this is underpowered. It's reject paper, reject paper. So it's really about forward planning gives you the most success. However, this doesn't mean that this needs to be done in every single study that is going forward to a clinical research abstract, which is what one of these webinars is hopefully trying to achieve.
Yeah, so for example, in a vet nurse in practice who has who just wants to demonstrate an occurrence of something, a phenomenon that they've noticed within their own practice, for example, they don't need to have a power calculation to bring forward some case studies that they think are interesting and that they've researched around, because that could be a preliminary or a pilot study on a small group, which then could extend to future research. Is that about right?
Exactly. And in fact, that's exactly what I've put in a lot of clinical research abstracts over the years, and I use them as my pilot studies. So when I say you need to have a little bit of an idea what you're going to get, then that is often based off pilot studies. And that those pilot studies give you that data. So although I'm telling you how to do an ethics application, how to start research, this is to give you all of the tools going forward, but certainly to produce a poster for a setting such as VOA, nobody's going to necessarily expect to see those. Or you can say, this is a pilot study, and I will go forward now and try to do a clinical study with maybe X many animals. That's how you translate your results into something bigger and better next time for your next time around. So by all means, if you think you have preliminary studies and data, then that's the kind of forum to kind of present them with. It may be useful to know how to be successful in clinical research. These are a few of my tips: is integrate it into your service provision. So if you are a nurse running a geriatric clinic, then have routine questions that you always ask, and therefore you're able to then come back and look at the answers to those questions. So if for example, you always ask the owner of your geriatric dogs, how much exercise do you give your dogs? How long do you go? And how far do you walk? Then these questions will always be there for you to do prospective, a kind of retrospective or even prospective study if you have that data already there. So make it something that is part of your routine work. Pick an area you're passionate about. You're all passionate people. I know this because you're listening to this webinar, so you've got to be interested in it. You know where there is a gap in a knowledge because you're probably asking that question. You know what's important, and you have to think about what is feasible and make it your own niche. There is absolutely no reason why the research has to be done by a specialist at all. Some of the best scientists I know are or were veterinary nurses who started doing research in veterinary practice. And some of the best research coming out is coming from physios, because they are seeing a vast number of animals with, say, sports injuries, which are just not being seen in veterinary practice. I would just a personal plea. I love that those sports injuries research. Please, somebody out there, help me with my iliopsoas injuries. Give me some research on what you are doing with that. What you're doing with your muscular tendinous injuries that are so challenging to treat and diagnose. So all of you out there have things you are good at. Develop that, and you know, you can do it. It is definitely not something that just people in universities and referral practices like me do. Develop your understanding of what is best research practice. That's why I'm telling you about power calculations and that sort of thing. It's not to scare you, it's just to tell you this is what is done, so that when you have a great idea, like my colleagues in the dog breeding um, uh, uh, trust, that you're not put off. Find a mentor. If you're feeling worried about this, there will be somebody in an organization, in the VAO itself, some of these organizations who will be very willing to give you advice. Um, if you do need to do an ethics approval, if you want to publish it. So not necessarily for a poster, but if you're thinking about then going on and publishing it, if you don't have that ethics approval, you just won't be able to submit it. So don't be scared about the ethics form. Think of it as part of planning your project when you're going forward with that. You need to track your data. That's what I mean by asking the same questions and interpret it. And what I say is, when you have an idea, is set an achievable goal. And I always advise people to decide to do a clinical research abstract at your society meeting. Now, I've put up the BSAVA there because it's an organization which is, and Congress is very close to my heart, and I am still devastated that it's gone. But here it shows a vet student, Tig, who's now well in practice. He's been one of our first cohort. And he did a project when he went to see EMS at a practice. Now, he didn't have to do a project. He just decided that this was something he was interested in. And he was encouraged to take that forward and present that at the BSAVA Congress. So I would say, set that goal. I want to produce a poster at VOA, and aim for that. That is a very achievable goal, because it's in many of these congresses, they like to see these things. There's a large scope for including them. Even in something like my own society, we very rarely refuse posters, and that's why there's over 250 of them every year, because we realize it's very, very important thing for young neurologists, it's a neurology society, to develop. And then after that, maybe be prepared to navigate the funding world. You know, if you are looking at osteoarthritis, for example, you may be able to look at a product produced as a nutraceutical, and maybe they will be prepared to fund a study. You can also get many small grants from charities and societies. A little bit more difficult at the moment in this economic crisis, but they do exist. But, you know, student bursaries, that sort of thing. And then you need to translate your findings into meaningful steps for patients. And I'm going to give you an example from a vet that I used to work with, or had the pleasure of working with, Harvey Carruthers. He was the head vet at the practice that I worked in, which was the Stone Lion Veterinary Clinic here. But you can see that this is not where he was working. I think he's still working here. And he was interested in this disease, L2 hydroxyglutaric aciduria, in Staffordshire Bull Terriers. This was because he was working with rescue societies. Now, this was a disease that had been described in pedigree Staffordshire Bull Terriers. He was concerned that in the rescue population that he was working with in the Dogs Trust, that some of these dogs actually had that, even though they weren't pedigree Staffordshire Bull Terriers. And so he decided to do a study. And it was a very simple study. He got some funding for it, and he simply took a number of these dogs, selected at random from all of these dog trust rescue centres. They took a buccal mucosal swab, so it wasn't invasive to the dog, and tested for it. And he found the incidence of this genetic mutation. You can see he had a lot of support from social media. It says here in this L2 hydroxyglutaric acid urea society, which is all owners, here he is off to the British Small Animal Veterinary Association to present some of our work, they say, because he was involved with these societies and rescue staff. We wish him luck. And I think that's wonderful to see that this is an owner society. They wanted this work done. They asked their local vet to help them with this, not a research organisation. I know the Animal Health Trust is on there, but that's because that's a geneticist that arranged that. So he did all of that work and then was able to feed back to them about whether or not they should do this testing routinely for that. Because he found that one dog in 1,000, so probably not worth them paying for these tests, but certainly to look for the what signs to look for the disease. And then he eventually wrote this up as part of a paper. So I think that is a person who was working in general practice, as very, very busy vet, but managed to fit that research into his routine. Started with a small goal, and that small goal was to do the study, which he then presented, and then went on to a larger goal of writing a paper.
So that's fantastic and a really great example of how that's all come together. So we've got our idea, and we've developed it into a research question. We've gone out there, gathered all our data. We've done some basic stats on it, maybe some more advanced stats. Get a statistician to help you. This is my advice on that. And so now we're wanting to present it. So how do we go about presenting that information that we've gathered from our research project into a poster that we can display at a conference?
Yes, that can seem a very daunting question. Well, first of all, there's lots of poster templates out there, and we're just putting a very rough example of one here. I suppose the first thing to decide is what you are going to make your poster in, because there's no hard and fast rules there, but it should be done in a software package of some kind. You could do it by hand, but generally those handmade ones look very, very amateurish compared to all the professional ones alongside. So most people will be producing their posters in PowerPoint, but there are some other formats out there which I will go into. But this is an example of a template in PowerPoint, and I believe you're going to make a list of resources that are available to people listening to this webinar. Is that correct?
Yeah, absolutely. So there will be instructions on how to create your poster. There will be links to different examples so that you can see other work and how that's been presented. And I will point out that this example on the screen now is an example of a PowerPoint poster and how to get started on a PowerPoint poster in landscape. And it's really important that you look at the submission, the qualifying aspects of the submission, the instructions that you're given depending on the conference. And specifically for the VOA, we're actually asking for portrait. So that's quite an important differentiation, isn't it?
Yes, look at the instructions first. The size of the poster, and uh, the orientation of the poster. And if you're doing it in PowerPoint, what you do is you immediately set that PowerPoint to portrait or landscape. And there is buttons in PowerPoint that allow you to set the size. And the most common poster size in my experience is A0. We've all heard of A4 paper. Well, A0 is the biggest size. The other thing is when you get your poster printed, which we can talk about later, then they will also, the company for that should check. But I think because of mistakes that are often made, they will often come back to you and say, "What are your poster guidelines? What are you looking to have?" And you say portrait A0 or portrait and these dimensions, just to doubly make sure that it does print out in the dimensions that you actually want. So the first thing is to make sure that your software is set to the size that you intend it to be. In this particular one here, you can see a very traditional format. So we have the presentation title, which we'll put in here. And then we'll put the contributor details or the subtitle. And then we have, it's usually set in vertical columns. And so we'll add the text. We may add some pictures. I would commend you do so. Add some more text and so on. And then we have a footer down here, which is usually your references. It may be easier to go to some examples of posters whilst I talk to you about some general tips we have here. So these are two posters that I produced this year, and they work quite well as examples because we have the exactly the same subject, really. Very slight difference in the results of them. And on the left-hand side of the screen, we can see a PowerPoint style, very traditional in columns. And then on the right-hand side, we can see a Canva style, which is much less conventional and more visual. They were produced for two different conferences. And the difference in the conference was the first one was produced for the feline ICAT, International Feline Society Conference. And there are very few posters in that conference. By comparison, there's only about 20 to 30. And they have a lot of time in the poster sessions. They make a nice amount of time, which I very strongly believe they should. And so each person at the poster is likely to spend longer reading and analyzing it. As a contrast, this poster here is one I produced for the European College of Veterinary Neurology, where there are 250 posters with not enough time to view the poster. So my purpose in this is that people can get the message from this poster in 1 to 2 minutes. Very rapid, able to get the message and very quickly move on, because basically, unless they're particularly interested in it, then they are not going to stay there and read through the whole thing. But as a general principle, a poster is a visual thing, a visual abstract. It is not your paper, your entire project on the wall. You do not want to have people reading through every single detail, and do not think that you have to put down every single detail. You want to have that 1 to 2 minutes of take-home message. What are you trying to say? What is the take-home message? Can they just read the discussion or the conclusion here and read that and go away again and know? The other thing is that they should be able to read it from a distance. So in many ways, this one fails. This one is much more effective. People can see that from a long way off what this is about. They should be able to understand the message from at least a meter away. You need to have it quite clear. The white space actually is functional. Having a generous margin and having a lot of white space round improves readability, which is why in this one, when I had these little call outs, these are comments from owners in this epidemiology survey. Rather than having great big bits of text, I've put a little comment coming out here that makes it a little bit easier to read. You need to have an ideal font, and don't be going for, well, let's say it, don't be going for Comic Sans. I don't think anybody will go for Comic Sans, but or something like that. Don't be going for fancy stuff. You want something that's really clear. The sans serif fonts are basically the ones that are recommended. So these are things like Arial, is that how we say it? Arial, Calibri, Helvetica, so not even Times is okay, but Times, which is the one that we generally write in for letters, is actually not as legible from a distance. So I would say I use Calibri or Arial. If you have a template, then often that is written into that template, but not surprisingly, not sometimes. Sometimes they have surprisingly small letters. You really want to go the biggest size that you can go. You need to keep the same font throughout. You don't want to be going one font here and one font there. It just looks messy. And these are easily Googleable, and I'm sure you're putting guidelines there anyway. But the titles are usually 90 to 120 point. Authors are a bit smaller than that, 50 to 70, so you can see who it is. Section headers are a little bit smaller than that, 44 to 60. Body text, which is the text that you can read, should never be below 24 point. You need to reduce your words if it's having to be there, and the same goes for your figure captions. And if you're basically, you should be able to stand back and read it from a meter back. And yeah, most people put it in these kind of columns. And I think as a general rule, having at least 50% of the poster being figures and diagrams is a good rule. Otherwise, it's just off-putting. Nobody wants to go home to go up to an essay. You want to be attracted in there, and you can see in this one. I'm really going for the whole cat appeal, aren't I? I've chosen these lovely cat pictures because I think anybody who likes cats is going to be attracted to those. And one of the other things I would say between them, working in Canva is much easier than working in PowerPoint. There is a lot of pre-existing templates, a lot of pre-existing stuff. The only problem is that you get the really good stuff if you pay for it, and the free one is less so. The other nice thing about Canva is that it does your complementary colors come up automatically. So it will automatically suggest if you put a figure in, for example, that's got a if you put a figure in, for example, that's got orange and blue, then it will kind of automatically offer you the orange and blue to match it so that it looks aesthetically pleasing. Whereas in PowerPoint, you have to choose everything yourself. And if you're maybe colorblind or personal taste can mean that some posters look more aesthetically pleasing than others. The other reason why Canva is easier is that when you put a picture in Canva, it just stays there. I think we've all had the delight of working in Microsoft Office, and you put a picture in here and then you add something else and the picture's suddenly down there. Fiddling about with all of these things in PowerPoint, you can see this is a nice grey column here. With that is one entire box here with that word in. That has to be lined up with that box of text under it, with that box of text, with that box of, it all has to be minutely lined up and put into line, and to get that effect there is not one column, is what I'm saying. It is a lot of different series of boxes, and once you move one, everything else moves out of sync. So making it in PowerPoint is much more complicated, whereas making it in Canva, it just automatically lines stuff up. So it's much easier. But unfortunately, to get the best out of it, you have to pay for it, which means if you're an organization which doesn't pay for it, then that is more challenging.
Yeah, having just been through that with myself, I know exactly that hardship of lining everything up. I can see you've put some QR codes on there as well.
Yeah.
Yeah, why is that?
Well, for a number of reasons. For in this instance, this QR code here is going to, and I think one of them here is going to a video of an affected cat. And I think that's something that we can do and is very popular in a lot of posters now, is that we can, if we want to convey something more visually, then we can say, scan this and see what this animal looked like in real life. See me doing physio in this animal, for example. If you've got a particular technique that you used or you're trying out, you can invite people to have a look at that. And that will go straight to a YouTube video here. Or this one down here goes to my own personal website where I have frequently asked questions about feline hyperesthesia syndrome. So I'm basically directing people to more information. The other thing that people do is what we used to do back in the, before we had as good technology as we have, online technology as we have now, is we used to print out our poster, and then we used to print out A4 copies of the poster, which we put in a lovely little folder and hung on the side, and then people would take those single A4 copies of our poster and have a nice, lovely written copy of it. That is still done, and many people still like that, but of course it's not very environmentally friendly, and if you printed out 100 copies and nobody takes it, it's a bit annoying. And likewise, if you printed out 100 copies and people don't have a copy, also more annoying. So what you should also think about when you're doing a poster is it's not just about your experience at the VOA conference or other conference. You want to think of what else can I get from my poster. What I very, very strongly recommend that you do is that you get a ResearchGate or similar profile. There's no cost involved, you just make it, and then you upload your poster to that. So, and what that will do is give you an instant DOI for it. You're thinking, what does that mean? That means you can reference it. So when you write your references, we decided not to put references here because it was a little bit of it too much of an extravagance. But if you write your references for a paper, etc., you can reference your poster by going to the DOI. But it also means other people can download it. And so one of these codes could be to your poster on ResearchGate, and you could say, download my poster here. So people are more familiar with it. And the other thing that I recommend that you do think about your poster is that can then be ResearchGate poster can then be linked in your social media posts by your practice, and it can say, Claire we were very proud of Claire. She presented at the VOA conference, and she presented her poster on this. And then there's a lovely picture of you presenting your poster at the conference, and say, read about her research here and link it to that research gate so that your clients are able to access that and then be very, very impressed. And of course, the next thing that you do with your poster is it goes into your practice waiting room. And you're able to say, look, this is the research that we're doing in our practice. This is the research that I'm doing in my physiotherapy work, and part of your decoration or your consulting room, so that you're able to get more mileage out of that. So definitely after the event, be promoting it on social media so that you're able to showcase what you're doing.
That's fantastic. So, we've got the benefits of submitting that research. We can add something to our CV. We're adding something to the general knowledge and the veterinary knowledge of a certain area. We're collaborating with colleagues or industry professionals. And then once we've been through the procedure of doing the research and presenting our poster at the conference, we can then use that again further. So we can link to social media, we can share that poster in waiting rooms. So I would just want to thank you, Claire, for that is so much of your experience and your knowledge coming through. And I think that this is going to be really valuable for our VOA members. And I really hope that we have been able to encourage some interested parties, shall we say, who are, teetering on the edge of wanting to get involved in research, but didn't really know how to dip their toe in the waters.
Yes,
So I just,
as I say, the research curious.
yes,
Turn
absolutely.
turn research phobia and research curious into research active. I look forward to seeing all these wonderful posters that are going to be produced.
Great. So if you do want to submit a poster to the VOA conference, there are guidance notes that come with this webinar and that are on the VOA website that